Hi guys, I'm Brenda. I'm going to be talking about ACEs and pediatric obesity. So first, let's just define ACEs. These are adverse childhood experiences. They were defined by Folletti et al. Way back in '98, and they include 10 ACEs, and they're all related to categories of different types of abuse, of neglect, of familial incarceration, mental illnesses, lots of substance abuse, familial divorce, and different types of violence as well. So why is this important to us? So this is causing an increased likelihood of morbidity in adulthood, including metabolic disease, cardiac disease, lots of psychiatric issues, and especially, again, substance abuse. So why this is important? So these maladaptive coping mechanisms that kind of form as a result of ACEs can affect the person's health behaviors and then cause these adverse health outcomes in adulthood. So a cross-sectional study in China found an increased likelihood of drinking, of chronic disease, of depression, and of PTSD in people who had experienced ACEs in their childhood. And I know we're all science nerds here, so enough of the soft science. There's also biochemical markers associated with ACEs. So this 2018 systematic review looked at a ton of studies from 07 to 17, and they saw across the board inflammatory markers like C-reactive protein. They saw BMI derangement on both ends of the spectrum. There's genetic implications like telomere length, which is a whole rabbit hole I won't get down right now, in an emerging field too. It's pretty cool stuff. And then endocrine disruptions like cortisol issues, which we know is associated with stuff like metabolic syndrome. So as far as obesity goes, this 2020 systematic review with a big N, they saw participants had a 46% increased odds of obesity if they experienced ACEs. This was highly significant. And then a 2020 cross-sectional study of kids aged 2 to 20, smaller N, but 28% of them did have at least one ACE, and they were 47% more likely to be obese, and this was also significant. These are pretty similar findings here. So this Polish study saw, this was a clinical cross-sectional study, and they saw BMI derangement on both ends of the spectrum in kids aged 6 to 12, and they saw 3 times more likely kids to be underweight if they experienced ACEs than their counterparts who did not, and 5 times more likely to be obese if they experienced ACEs than their counterparts that did not. And so as far as obesity and ACEs in America, so we have lots of data from the National Survey of Children's Health. This was a 2021 retrospective cross-sectional study, and they were looking at kids 10 to 17. 15% of them had obesity, and the presence of obesity was positively correlated with the amount of ACEs. So the more ACEs they had, the more likely they were to have obesity. This was highly significant. And then a 2021 cross-sectional study was assessing ACEs and cardiometabolic risk factors for Hispanic adolescents. And they saw that more than 4 ACEs was significantly associated with a higher BMI and also both higher systolic and diastolic blood pressure. So implications and possible mechanisms of this association. And in 2019, there was a study that looked at ACEs and cognitive performance, and they saw worse cognition as far as fluidity, memory, and word tests like word recall in adult patients with excess adiposity and ACEs. So this was highly significant as well. And we know that folks who are struggling with their cognition might make poor health behavior choices. In 2017, there was a study in Denver with kids 9 to 11 years old in foster care that had sleep disturbances and ACEs. And those with sleep disturbances and ACEs were more likely to engage in juvenile delinquent acts. And so I'm thinking there might be a link to sort of these maladaptive behaviors and difficulty coping. So more potential mechanisms. A secondary analysis of adult participants in a PTSD study, they were looking at emotional regulation difficulties and outcomes of depression and physical health. And they found that there was a significant positive correlation between all three of these variables and those with ACEs. In 2021, there was a retrospective cross-sectional analysis, again, of the National Survey of Children's Health data. This was from 17 to 18, big N, and they saw that participation in sports was significantly less for children with ACEs. So this might be another potential mechanism, just a less likely to engage in structured physical activity, which we know is going to help mitigate excess adiposity. So if girls had more than 3 ACEs, they were 49% less likely, and boys were 44% less likely to participate in sports. So there's a pretty strong correlation here between obesity and ACEs and these poor health outcomes. So I didn't find a lot of counter arguments, but there was a little bit of literature out there looking at depression and obesity more so than ACEs, and maybe there's a stronger correlation here. So poor coping skills are associated with obesity and in adolescence more strongly than ACEs. And a 2018 systematic meta-analysis of 22 studies saw the prevalence of depression in obese female children was 1.3 times higher than in those with a healthy BMI. So I still think that this points to ACEs being causative here, and maybe depression being secondary to ACEs or comorbid. I don't know if you could call ACEs a morbidity, but co-occurring. And so we really can't stop ACEs from happening, and that's why this really isn't a controversial issue. It's really, the controversy is how we're going to treat, how we're going to intervene here. So a 2021 study examined psychological resilience as a method of reducing adverse eating behaviors. So they had Hispanic youth here, and they saw a significant relationship between resiliency and both just overall increased caloric intake and increased sugar consumption as well. So as the youth scored lower on the measures of resiliency, their calorie intake went up and sugar intake went up like incrementally with each score. So this was a pretty cool study and came out with some highly significant data. So more ways that we can address this. Cultivating self-worth and alleviating depression symptoms might really help here. So this was a 2019 study, and they randomized children to either a sedentary or an aerobic after-school program. The outcomes they were measuring were quality of life, depression, and self-worth, and those all improved with the aerobic group. So improving self-worth might give children a little more of that personal autonomy, of that ability to make healthier choices in their life. And as far as coping skills go, in 2019, there's this cool study, it was longitudinal. They were looking at kids at the initial visit, a month after, and then 3 months after that. They were checking in with their primary care provider who gave them park prescriptions. So they were reporting their park visits per week. Then they were also measuring stress scores, ACE scores, coping and resilience scores. And their findings were really cool. They saw a 4% increase in resiliency scores with each additional park visit per week. And then there was this school-based game intervention that was teaching kids about nutrition and coping skills. Seemed like a really fun, like time-based kind of game, this or that style. And they did a pre and post test, and they saw an increase in knowledge of coping skills and nutrition for the kids. And the kids also reported really liking the game. So this could be a fun intervention to implement as well. And then just some more about resiliency and then also trauma. So in 2015, there was an Empower Resilience program. It was meant to increase health behaviors using strength-based intervention for young adults. And they did see an increase in positive health behaviors when the young adults were exposed to these strength-based interventions meant to increase resiliency. And then in 2019, there was a randomized control trial. So this was teaching teachers to have more trauma awareness, enhance their trauma awareness. So it was really how they reacted to these outbursts of their kind of problem children in the classroom. And they did see the same amount of outbursts. They saw, you know, the kids were behaving the same way, but the teachers were responding in a different way. And they did see improved student-teacher relationships as the only significant outcome of this training. But I see this as a really important piece here and worth pursuing, because improving those teacher-student relationships, that might be the only positive relationship a kid has in their life, and that could really improve their feelings of self-worth and support their coping skills and give them some support in their life, some personal support. So more interventions. In 2021, there was a randomized controlled trial for desensitization and mindfulness-based practices for adolescent girls. This was a 1-week intervention education series. In the intervention group, they saw a significant reduction in trauma-related outcomes. They were measuring a pre and post-test after this 1-week intervention. This was highly significant. And then they saw the girls again 2 months after the intervention, and they saw that trauma-related outcome was able to stay stable. And then some more ideas for intervening as far as ACEs go here at the systematic level. So reducing stigma related to ACEs and trauma. So there's this year a survey study that was done over the internet, and they were doing a pre-post test of people's feelings towards policy related to trauma and ACEs. And then in between tests, they implemented either different types of messaging, some different education, and those who were learning about economic impacts of folks being exposed to trauma and ACEs were more likely to support public policy to help folks out. And then those who saw messages about the racial inequity related to ACEs and trauma were less likely to support these policies, unfortunately. And there was no messaging that affected the stigmatizing attitudes or feelings of parental blame that participants felt at the end of the study here. So we can do as much as we can in a child's short childhood to give them the support, give them the coping skills, and develop resiliency. But a lot of this work is going to be lifelong. So we're going to see adult patients who have experienced ACEs and trauma, and they need support too. So this 2022 randomized control trial, these were adult participants who had experienced ACEs, and they were randomized to either cognitive processing therapy or dialectical behavior therapy, PTSD style. It was a superiority study out of the UK, and they found that the DBT PTSD was superior to CPT. However, both were effective in mitigating trauma responses and supporting coping mechanisms in these adult participants. So as far as areas of future research, I'd really like to see more studies and more creative interventions that will help support this resiliency for youth, with an emphasis on coping skills and emotional regulation, and then setting up some more systemic policy to support youth who are unfortunately affected by ACEs, and then support adults who also experience this. And of course, prevention of ACEs would be ideal. And we can't do a lot about this ourselves, but if we do see something in clinic, if we're seeing pediatric populations, making sure we're reporting that to the social worker and getting it investigated as thoroughly as possible could really change someone's life. And then, you know, supporting our social worker, child protective service friends in all that they do as well. So as far as conclusions go, ACEs are associated with obesity in children. We're seeing about a 46 to 47% increase odds of obesity in those who experience ACEs. And this obesity will likely follow them into adulthood. And we're also going to see some comorbidities with that, cardiometabolic issues and psychiatric issues, especially substance abuse. For potential mechanisms, this may be emotional dysregulation and then subsequent difficulty with coping with these emotional difficulties. And that can kind of be summed up as resilience. So what we're looking for as far as intervention is cultivating that resilience at an early age and hopefully avoiding a lot of these comorbidities and getting some positive health behaviors instilled in these children by supporting their resiliency. And then also just, you know, trauma-informed care across the board so that we're always, you know, imagining, we saw a stat at the beginning, there was like 28% of these kids had experienced ACEs. So it's, you know, that's the likelihood that your patient could have experienced some trauma in their life. And really taking a multidisciplinary approach, connecting somebody with the support that they need to provide trauma-informed care, because working on that coping skill level could really make the difference as far as in nutrition or health, whatever career field you're in here. But especially in nutrition, helping people with coping skills is really important as children or adults. So that is it from me, guys. Thank you so much. And